I'm interested because you just talked about the measures overseas, they're paying for them, etc. This government has given us the free,
Yeah.
boosters and stuff, or sorry, rats and stuff till June the 30th. Is there, if you are able to answer this question, you may not be able to because of your position, but is there any talk amongst your peers, and I guess I'm talking about those in the realms of science who are doing stuff in and around COVID, of concern as to how this government's going to handle it versus how it was handled?
Well, of course, like as in the more it's not spoken about, the more concerned we get. And not speaking about it indicates you're not going to do anything about it, right? Like as in we need to hear what's happening. And to me, it won't be surprising if, yes, all of these things that we follow the rest of the world and cut funding and all the rest of it, it's alarming, but, it is alarming. And to say that we're prepared for pandemics and all the rest, we're not. We're in a situation where it feels like we are not putting into place what we should be putting into place. But as I say, a lot of this is a global problem. It's not that it's just us. It's just the crazy thing is out there on the other side of the world, everyone still thinks New Zealand's wonderfully doing well, and I'm like, excuse me. So internationally we're riding that wave, and it's kind of frustrating to hear, especially on behalf of those suffering so badly here. You know what I mean? Like, as in when we know how much suffering this current pandemic that we call over, people are suffering, people are not getting support. There's no government support. There are no clinical pathways. There's zero ticks across all of the things that should be being done. And globally, people don't realize that this is the situation we're in. So, and it's not going to go away. And that's layered upon, the health system strains as it is, like we always, it's really frustrating being, the speaker outers, if you like, because it sounds like we're just sort of, spend more money. Generally speaking, preventative measures are far better, money well spent, than trying to treat a disease that is chronic or has no cure for, and all the rest of it. All of those things that compound when we do nothing cost far more money in the long run, right? So it's preventative measures are always better for our economy and all the rest of it. So that's the thing. Yes, some people I'm sure get sick of these messages, but we're trying to prevent the long-term harms because the data doesn't lie. And just because we're not tracking it doesn't mean it's not getting tracked in other countries, and the absolute dire outcomes of, people plummeting or dropping out of the workforce. And yes, teachers and healthcare workers are top of the list of not being able to return to work. As we know, as it's hit our headlines in schools, that was no surprise to me, and it's going to continue because the messaging around schooling and that this complete blind spot, that the lack of attendance in school, if you don't say the word illness, what? Like, if you're not considering illness as a reason for, attendance problems, then what rock are you living under is kind of the scenario here, because look at all the international data.
Let's just have a look at this. Sorry, Chair, I was going to throw to you now, but just because you've just mentioned it, Anna, this was Q&A in the weekend. This clip's only like 40 seconds, but because you're speaking to teachers, so Jack Tame points out that, as you've just said, teachers are at the top of the list for catching COVID, also long COVID. And just all of us listen to Erica Stanford's response to that. Remember, occupation safety and health means that government says you have a standard of care, a due diligence to keep your workers healthy. Like if a factory floor was causing people to be sick because of something like asbestos, that would be off the charts, legal issues and complications here. This is what Erica Stanford said in the weekend when Jack Tame asked her about why are teachers at the top of this list.
A 2022 Ministry of Health data found teachers have the highest self-reported case of COVID infection of any profession. Otago University researchers found teachers are the most susceptible when it comes to professions for long COVID. Why do you think that is?
Well, because they're surrounded by sick kids, I guess. I mean, that's the key, right? And so
that's all I need to show you. Just like, why do they get COVID? Well, because they were surrounded by sick kids. Later in that interview, which we'll look at later on, Shui, Jack Tame challenges her. So you're I'm using my words now, your big swinging dick where you're going, oh, we're going to get more kids back at school. How is that going to conflict with these teachers getting sick based on COVID? So Anna, happy for you to speak to that.
Oh, it's just, as I say, a blind spot. Force sick kids to go to school so that there's more illness at school, so there's more sick teachers for bums on seats. It doesn't work like that. Sick kids staying home keeps more kids in school. Like where's the logic, lack of logic here, right?
Yeah.
And if you stop and ask the question about, what is causing low attendance and all the rest of it, or all of the issues that are impacting the education system, and you're not asking about illness, you're not doing your job, right? Like, as in, you're not asking all the questions. You're missing data. You're missing data. So it's a bizarre scenario that, and I say this also off the back of what's happening elsewhere, like in other countries, right? Because it's the same message. It's the same message. There's some outrageous messaging happening in the UK. Can't remember where it was, but it was almost like a comedy skit. It was that bad. Like, as in, is this actual reality, what's been educated publicly? And it was about saying, of course, your kid can go to school. Look, they've only got a sniffle. And it was just like, how are we here when there are measures that can be done? The constant messaging about ventilation and all of those things. Because let's not just forget, yes, okay, there's acute illness, sniffing, coughing, and feeling horrible, and all of that, which then spreads in the classroom. But even, let's say you've recovered and you're back, and you're not really recovered, right? Because it's COVID and you may have a lingering time to recover. And I'm not talking about the actual chronic illness. I'm just talking about recovering in a sort of a normal sense. Yeah. You might have a delayed recovery where you can't even function at school because you have the impacts on the brain foggy. So, basically just a long tail of recovery. And then layered on top of that, of course, the long COVID problems as well. And the reason why school teachers are so high risk is because we know that the more times you're exposed, the more chance is that you will get long-term impacts. And it's not sort of a complete sort of upward climb, right? Count how many infections. It's just that we never know. Like, as in any single one time when you're exposed, today might be the day that you're at peak risk, because we can't track and we don't know why today you're at risk, right? And so what we do know, the way to limit, any particular time that you're most at risk is limiting infections. So yes, we hear constantly of infection 7, infection 8, all of this happening in the UK, and it's not doing anyone any good, with constant re-exposures like that. And those that are chronically sick too, like, what about, vulnerable children? Do we have a head count on how many children in our education system are considered vulnerable? And therefore, has anyone asked if that's why there's a reason why attendance may be down for some families? It's not just the child, but what about the family unit? If that infection could impact the family unit, that could be a reason to, not have your children at school as well. There are loads of reasons, and everyone is just kind of polarizing or blind spotting the fact that this virus doesn't exist, as if it's just any old infection and we should just move on. And sadly, that is not the case. So all of these things are never part of the conversation, all the data, all the questions when we're asking about, situations of education systems, whether it's the children, the teachers, and so on. So it requires policy. And as you just described, workplaces, are required to not expose us to risk. So, if we know there's a risk, it's a high risk job.